Hi, my name is Willa Arnett. I've been a nurse practitioner for about 27 years. I am currently working in a PACE center, and I also have a private practice where I use the Alpha-Stim device. I first learned of the device through a representative. I am the educational coordinator for our Nurse Practitioner Association in the Western New York area. He set up a dinner meeting with the nurse practitioners in our area, and it was phenomenal. So that night I tried it. The next day I was on a plane, and I hate flying, but I was so calm and relaxed with this device. And since then I've been trying to promote it. So I got the program that I work for, the PACE program, to invest in 5 different devices, including the Alpha-Stim M. We use it a lot in our clinic and in our day center, especially with patients who are older and cannot tolerate benzodiazepine. They get pretty worked up in the center sometimes. So we apply this device and we have seen wonders. But there's 2 people, they tried the Alpha-Stim, and they're both pretty calm people, not really outgoing, but just, they sit back and they're pretty quiet. But they both tried the machine and they kept saying, I don't feel anything. But I did see them like 1 to 2 hours later. And the one lady, she said that she felt like she had a glass of wine and she actually looked like it too. She was so relaxed and just giggling and just freely conversating. Her whole body language changed. And then the other one was our medical director. I saw him. He's normally pretty quiet and, reserved. He was not when I saw him. He was just giggling and looked like he was having the best time of his life. I really love this device. We have this device at a local cancer center in Buffalo, and they use it on the staff as well as the patients, and they use it to help with anxiety. I currently use it for insomnia, and I think it works well. I love it. We do use it on a few patients, and I have been able to taper their pain medications, especially the ones that are on narcotics. But when you think about like people may have been treated for anxiety all their life, and they feel like they need to take that Valium or that Ativan, this can replace it. Like this can lower that pill burden that people take for multiple medical problems. And all you have to do is wear this device for 20 minutes. That's amazing. You just treat yourself with the probes for management and you're eliminating pills. So I would love to see it used more in nursing homes as opposed to chemically restraining patients. I know we use it in our day center. We have had great results. I hope to see that more people try it in my practice. I know they have agreed to it when I do a facial procedure and they actually fall asleep while I'm working on their face. So I hope that that's what happens is that insurance companies, medical institutions, they see the benefit of this device. So for myself, like I said, I have a hard time falling asleep. And since I use it about 3 times a week, I have no problems falling asleep. And then I wake up refreshed. I have tried like trazodone, melatonin, and stuff to help me sleep, and I don't need any of that. That's my experience. But I had this one patient. She has a quite a few mental illness issues. She was very angry about her kids, her adult children, and she was being seen by myself and the social worker. Well, she was sitting there just like really angry and tense. And, I showed her the quick video about Alpha-Stim and I asked if she would like to try it. And she agreed. It was amazing. The social worker and we just watched her, like just be really mad and tight and angry to actually seeing her shoulders calm, her face relax, and her voice, the tone of her voice, everything just changed. And ever since then, she's very faithful about getting it every Monday, Wednesday, and Friday. So she's my favorite patient story.